World Breastfeeding Week is held in the first week of August every year. The theme for 2024 is Closing the Gap, Breastfeeding Support for All. The campaign will celebrate breastfeeding mothers in all their diversity throughout their breastfeeding journey. What is the meaning behind it? Closing the gap, breastfeeding support for all. Breastfeeding can act as an equalizer in our society, and efforts must be made to ensure everyone has access to breastfeeding support and opportunities. It is essential that no one is left behind, especially vulnerable mothers who may need additional support to reduce breastfeeding inequalities. Target audiences include actors along the warm chain of breastfeeding support, civil society organization, government, policymaker, health system, workplaces, communities, and parents will be engaged to close the gap in breastfeeding inequalities and support. What kind of support? Policy, attitude that value women and breastfeeding. A women and breastfeeding friendly healthcare system, and also respect for women's autonomy and her right to breastfeed anytime, anywhere, and also community support. This is the World Breastfeeding Week celebrated on this theme. Why this is related to my topic? Today's my topic is on breast cancer. Is breast cancer related to breastfeeding? Yes, breast cancer is related to breastfeeding. Breastfeeding reduces the development of this disease. If one mother breastfeed her baby at a certain stage or age, this mother reduces or risks for chances the breast cancer in her life. Obviously, breastfeeding is related to breast cancer, so we should encourage breastfeeding theme and breastfeeding support, and we should celebrate the breastfeeding week to reduce the chances of breast cancer. So today's topic is breast cancer. Let's talk about breast cancer. Myself Paramita Chatterjee, MSc in Medical Surgical Nursing. Breast cancer is a journey that affects millions of people around the world. It touches lives, our family, and our community. Today we aim to understand this disease better and explore the way we can support those affected by it. Before going to the breast cancer, we may know about what is breast cancer. Breast cancer occurs when cells in the breast grow unconditionally, uncontrollably, and these cells usually form a tumor that can be seen on an X-ray, or you may feel during palpation as a lump. While most breast lumps are benign, but some of them in benign condition are malignant and spread to the other parts of the body. So some important information is related to breast cancer. It is related to objective questions are: breast cancer is a disease in which cells in the breast grow out of control. And breast cancer is most common cancer in women. Invasive ductal carcinoma is the most common type of breast cancer. 80% of all breast cancer diagnosis as invasive ductal carcinoma. Which is the most common type of breast cancer? Invasive ductal carcinoma. Important short question. Most common site is upper outer quadrant of the breast tissue. Most common site, upper outer quadrant of the breast tissue. Metastasis occurs via lymph nodes, and common sites of metastasis are bone and lung. Before going to the disease, breast cancer, we should have some knowledge about anatomy of breast. What is the anatomy of breast? Breasts are made up of fatty tissue. This yellow color indicates the fatty tissue. The breasts are made up of fatty tissue and it contains small chambers. This purple color. It contains small chambers. These chambers are called lobules. This is the production house for milk. Lobules. These lobules, here the breast milk is produced, and breast milk travels through the tiny channels called the duct to reach the nipple. So this is lobules where the milk produced. This is the tiny channels called ducts through which the milk travel from the lobules to the nipple, and lymph nodes are situated inside the breast, located inside the breast, and lymph nodes are connected by lymph vessels. These are all important structure of the anatomy of breast. If we know about the anatomy of breast, then we can easily differentiate type of breast cancer. Before going to the type of breast cancer, we may know about the incidence of breast cancer. 1 in 8 women have a risk to develop a breast cancer, and 1 in 1000 men having the risk to develop breast cancer. Now discuss about the type of breast cancer. When this is normal milk duct, previously we know about what is milk duct. When this is the lobules, this is the milk duct, this is the nipple, and fatty tissue situated here. So what is milk ducts? When the productions of milk travel through the duct to the nipple, this duct is called milk duct. And when the cancer cells inside the duct, this is called ductal carcinoma. When cancer cells inside the duct, this is called carcinoma, ductal carcinoma in situ. When abnormal cells spread to the surrounding tissue, called invasive ductal carcinoma. When abnormal cells that spread to the surrounding tissue, this is called invasive ductal carcinoma. When abnormal cells developed in lobules, this is called lobular carcinoma in situ. When abnormal cells developed in lobules, this is called lobular carcinoma in situ. When abnormal cells spread to the surrounding tissue, this is called invasive lobular carcinoma. Clear? Okay. Then go for risk factor. First one is age. Then family history of breast cancer due to genetic predisposition. Early menarche before the age of 12. Menstruation, if we get menstruation history, early menarche, menstrual cycle started before the age of 12, and late menopause, menstrual cycle stopped after 55. Previous cancer of the breast, uterus and ovary. Nulliparity, nulliparous women, women who could not lactate, this is nulliparity, and high dose radiation exposure to the chest. We discuss one by one. First one is age, older age above 50. This is one risk factor. Then dense breast. What is dense breast? If patient have more connective tissue than fatty tissue, or patient have a history of fibrocystic disease of breast, then it's go to the risk zone. Then obesity, it is another one risk factor. Hormones, if patient have any problem and due to this problem patients are go through the hormone replacement therapy, then patient have a risk have factor for breast cancer. Another one, this is most important and this is frequently asked questions in breast cancer. Which genes are responsible for breast cancer? BRCA1 and BRCA2 genetic mutations. BRCA1 and BRCA2 genetic mutations are much more risk factor for breast cancer than radiation therapy to the chest area. It's one of the risk factor. And alcohol increases your risk of breast cancer. Family history can increase risk of breast cancer in older women. Family history of breast or ovarian cancer, you may ask family includes mother, grandmother and first degree relatives who might have suffered from breast cancer. So it is much more important area or risk factor. Then if one of them is and early menarche and late menopause. Early menarche and late menopause means if menstrual periods before the age of 12 and menopause starting after age of 55. And also previous cancer, if the patients have a history of previous cancers of the breast, uterus and ovaries, and the nulliparity. Nulliparity means nulliparous women. Nulliparous women means women who could not lactate. Nulliparity, if the patient have nulliparity history, then she has a risk factor for breast cancer. So these are all important risk factor: age, family history of breast cancer due to genetic predisposition, early menarche and late menopause, previous cancer of the breast, uterus and ovaries, nulliparity, high dose radiation exposure to the chest, and also dense breast density, obesity, and BRCA1 and BRCA2 gene genetic mutations and radiation therapy, alcohol, and also the family history. If the women with family history of breast cancer are more likely to develop the disease later in life. Then go for sign and symptom. First one is painless lump or mass in the breast. Breast cancer always starting time painless. So due to these reasons, the diagnosis is not possible in early stage because it's painless. Then breast pain, changes in symmetry or size of the breast. Both breasts are not in equal size and symmetry. Drainage or discharge from the breast or nipple. Changes in nipple may be if nipple have itching, burning and retracted nipple is present or not. Axillary node enlargement and dilated blood vessels visible through the skin of the breast. Dilated blood vessels visible. We discuss one by one. What kind of breast changes we may consider it's a warning sign for breast cancer? First one is hard and soft lump in breast or armpit and chest. Hard or soft lump in breast, armpit and chest. Then another one, breast sore that don't heal. Breast sore present. Another one, redness, puckered, scaly, thickened skin. Thickened skin present which is red and puckered, scaly. This is one of the warning signs that need immediate medical attention. And here nipple, inverted succulent nipple. Inverted nipple is much more important sign and symptom. Inverted nipple and sunken nipple. Then breast shape, size changes, bulges, dimples, flattens and shrinks or swells. And the last one is bloody cloudy smelly fluid which is leaks from nipple. Bloody cloudy smelly fluid nipple which is leaks from the nipple. So these are all breast changes and breast cancers warning sign that need the medical attention. Then diagnosis. What kind of diagnosis we may do for breast cancer? Breast cancer, first early detection. Early detections is regular breast self examination. Then mammography. Mammography reveals tumors that are too small to palpate. Those tumors are not palpable. Those tumors are not palpable. These type of tumors we may see in the mammography. Then ultrasonography. Ultrasonography distinguishes between a fluid filled cyst and a solid mass. Which kind of cyst is present? Filled cyst or a solid mass? These distinguishes are possible from the ultrasonography. Then fine needle aspiration and excisional biopsy. Excisional biopsy and fine needle aspiration provides cells for histologic examination to confirm the diagnosis. So confirmatory diagnosis are biopsy. And last one is tumor markers. We will be focusing on the assessment of breast cancer, a crucial aspect of early detection and treatment. Breast cancer is common cancer affecting women worldwide. Early assessment can significantly improve the outcome. So, let's walk through the key steps in assessing for breast cancer. So, assessment involves patient history, physical examination, imaging study and biopsy. So, assessment involves what kind of procedure? Assessment involves first one is patient history, then second one is physical exam, third one is imaging studies and last one is biopsy. So first we take the patient history. What kind of patient history we may take? First one is personal history. What kind of history we may take in personal history? Age, menstrual history, in which time menstrual started and in which time menstrual stopped, age at first child, in which age the patient get first child. This is also important. The age of mother who started her breastfeeding journey. So age at first childbirth and history of breastfeeding. How much duration mother breastfeed her baby, history of breastfeeding, then family history, any relatives, mother, grandmother, father, grandfather, first degree relatives have any breast cancer history? We may ask this question. Then genetic factors. Patient have BRCA1 or BRCA2 gene mutation present or not? Important factor, genetic factor. First I have discussed about BRCA1 and BRCA2. If BRCA1 and BRCA2 gene mutation is present, patients are much more risk for breast cancer. Then lifestyle changes. If patients have take proper diet, high fiber diet, high fat food, or patient consume alcohol, Patient have history of smoking, if physical activity present or not, sedentary lifestyle present or not. We may ask this type of question, we may get this type of history in patient history. Then previous breast health. Previous breast health means prior breast biopsy, prior surgery, prior radiation therapy. How was the breast condition, breast health? This type of history we may take from the patient or patient relatives. Then go for breast self-examination. During physical examination, we assess both breast, chest and axillary lymph nodes. The examination involves two processes, inspection and palpation. It is done in every month. It is done in every month. Both ladies who are still getting their menstrual period, it should be done on the 5th day or 6th day after your cycle or on your cycle. Okay, it is done in every month. Both ladies who are still getting their periods or menstrual periods are going on, it should be done on 5th day or 6th day of your menstrual cycle. And those ladies whose periods has stopped, she should mark any 1 day of the month. So calendar date should be maintained for checking of breast. It is no longer called as breast self-examination. Nowadays it is called that ladies should be breast aware. Okay, it is no longer called as breast self-examination. Nowadays it is called ladies should be breast aware. So how should be aware? How should awareness increase in between the ladies? So first one is we do inspection. Inspection with the patient sitting or standing position, observe the asymmetry of the breast and also the skin changes in skin texture and nipple abnormalities, discharge from nipple, retracted nipple, and also the atypical fullness or puckering present or not. So we should inspect first. In breast self-examination or breast awareness, we should first inspect our both breast. Then we go for palpation. First we divide our breast into quadrants and use the pad of your fingers. Systematically palpate the breast tissue, including the axilla. In which motion? In a up and down or circular and wedge pattern. We may use 3 type of pattern during palpation: up and down, circular and wedge pattern. Pay attention to any lump or thickening lump or any pain history. So this is our breast awareness or breast self-examination. First one, we should select our date on calendar. If any girls or any women who are in periods, then she should select her 5th day or 6th day on a menstrual period or during menstruation period. And if one woman who could not get menstrual period, then she may select any 1 day of a calendar for breast self-examination. Nowadays it is not called breast self-examination, it is called breast awareness. Patient or women should be aware about breast. For the 2 way we can examine our breast. First one is inspection, another one is palpation. So this is all about breast self-examination. They go for mammogram. The structured the standard screening of total the standard screening of breast cancer is the mammography. It can detect the tumors which is not palpable during breast self examination. Okay, got it? During breast self examination, which kind of tumor we can't palpate by our palpation procedure, this type of tumor we can screen by the use of mammogram. This is a very much standard screening tool, mammography. Then go for ultrasound. Often it is used to further evaluation of abnormalities. Better on mammography, which is found on mammography. This type of findings are better evaluated during the ultrasound. And those women, ultrasounds are very much important whose breast tissue are dense. This kind of breast cancer, which women have dense breast tissue, this type of patients are much more screened by ultrasound. And previously we talked about the ultrasound, in which ultrasound helps in distinguishes between a fluid filled cyst and a solid mass. This is the hallmark sign of ultrasonography. Which kind of action ultrasonography done? It distinguishes between a fluid filled cyst and a solid mass. So first one is complete breast self examination. During breast self examination we may do inspection and palpation. After that, mammography, which tumors that are not palpate in the breast self examination, this kind of screening we may do with the mammography. Then go for ultrasonography. Ultrasonography special criteria, it distinguishes between a fluid filled cyst and a solid mass, and also it's the better screening than mammography. And those women had dense fibrous dense breast present, this kind of patients are useful diagnostic procedure is ultrasonography. Then go for MRI. It is used in high risk patient or further evaluation of breast self examination. Okay, this is used for high risk of patient. Let's discuss about the biopsy, the definitive method for diagnosing breast cancer. This is the confirmatory diagnosis. Which kind of procedure or process done in biopsy? A biopsy involves taking a tissue sample from the suspicious area for pathological examination. And there are several types of biopsy. Fine needle aspiration, first one, then core needle biopsy and surgical biopsy. Fine needle aspiration. Fine needle aspiration uses a thin needle to extract tissue or fluid. And core needle biopsy uses a larger needle to remove a core of tissue. And surgical biopsy involves removing part or all of a lump for examination. So fine needle aspiration we use thin needle, core needle we use larger needle, and fine needle aspiration we may extract tissue or fluid. In core needle biopsy we may extract or remove core of tissue. Here extract tissue or fluid, here we remove core of tissue. And in surgical biopsy we remove the part or all of a lump for examination. Three types of biopsy. Biopsy results will confirm the presence of cancers and provide information on the type, grade and receptor status of the tumor, which is essential for the treatment planning. So in diagnostic procedure is much more important in breast cancer disease or treatment planning, because early diagnosis can preserve your life. Each step is crucial in ensuring accurate diagnosis and effective treatment planning. Early detection through regular screening and thorough assessment can save your lives. Then go for staging of cancer. Stage 0, carcinoma in situ. Stage 1, it is an early stage of invasive breast cancer. The tumor is no more than 2 cm. In stage 1, tumor size no more than 2 cm across, and cancer cells have not spread beyond the breast. Cancer cells have not spread beyond the breast and its size no more than 2 cm in stage 1. Stage 2, the tumor in the breast is no more than 2 cm, but cancer has spread to the lymph node under the arm. Then in stage 2, the tumor is between 2 to 5 cm and cancer may have spread to the lymph node under the arm, and the tumor is larger than 5 cm. The cancer has not spread to the lymph nodes under the arm. Here is the size. First size is no more than 2 cm in stage 1. In stage 2, first one is no more than 2 cm. Then tumor size is 2 to 5 cm. And the last stage in the stage 2, tumor is larger than 5 cm. Then go for stage 3A, B, 3A, 3B and 3B and 3C. Then 3A. The tumor in the breast is smaller than 5 cm. Tumor in the breast is smaller than 5 cm. In stage 2, we get 2 to 5 cm. And here the tumor in the breast is smaller than 5 cm. The cancer has spread to the underarm lymph nodes. Stage 3B, it is a tumor of any size that has grown into the chest wall and the skin of the breast. The cancer may have spread to lymph nodes behind the breastbone. Stage 3B, it could be more advanced. Stage 3C, the cancer has spread to the lymph nodes behind the breastbone and under the arm. The cancer has spread to the lymph nodes under or above the collarbone. And last, stage 4, it is distant metastatic cancer. The cancer has spread to the other parts of the body. This is metastatic cancer in stage 4. Now we go for surgical management. First one is lumpectomy. Which is lumpectomy? Tumor is excised and removed. This is lumpectomy. And then after that, simple mastectomy. Breast tissue and the nipple is removed, but lymph nodes are usually left intact. Only breast tissue and nipples are removed in simple mastectomy. What kind of procedure done in modified radical mastectomy? Breast tissue, nipple and lymph nodes are removed, but muscles are left intact. So go for the picture. This is lumpectomy. Tumor and tissue removed only in lumpectomy. Then simple mastectomy and modified radical mastectomy. Breast tissue removed but lymph nodes intact. In modified, this is simple mastectomy. Breast tissue removed, nipple removed but lymph nodes intact. But in modified radical mastectomy, breast tissue and lymph nodes removed. Breast tissue and lymph nodes removed. This is modified radical mastectomy. Okay, clear? In simple mastectomy, we only removed breast tissue and nipple, lymph nodes intact. And in modified radical mastectomy, breast tissue removed and also lymph nodes removed. This is modified radical mastectomy. Then radical mastectomy. Removal of breast, pectoral muscles, pectoral fascia and node also. This is the radical mastectomy or total mastectomy. Here is the picture of radical mastectomy. This is the picture of radical mastectomy. Okay, breast tissue removed, pectoral muscles removed, pectoral fascia removed, and also removal of node. This is radical mastectomy. And the last one is axillary lymph node dissection. This is the surgical management part. Then we go for chemotherapy. We are focusing on chemotherapy for breast cancer, a common or often effective treatment option. Chemotherapy is a type of cancer treatment that uses drugs for what? To destroy cancer cells. These drugs work by targeting rapidly dividing cells. Chemotherapy targets the rapidly dividing cells, and it's a hallmark of cancer because these chemotherapy drugs not only target the cancer cells, it also affect the healthy cells. So side effects are present here in chemotherapy treatment because it not only affect the cancer cells, it also affect our healthy cells. So different stages of chemotherapy. Two stages we used in chemotherapy. First one is neoadjuvant chemotherapy and second is adjuvant chemotherapy. Chemotherapy can be used in two stages: neoadjuvant chemotherapy or adjuvant chemotherapy. It is often used before surgery. For what reason? When it is used before surgery, its actions is only shrink the tumor. If tumor is small, then it is easily removed by surgeon, so making them easier to remove. So chemotherapy used before surgery. When it is used before surgery, it is called neoadjuvant chemotherapy, to shrink the tumor and making them easier to remove. And it is used after surgery. When it is administered after surgery, it is called adjuvant chemotherapy. An action for what it is used? To eliminate any remaining cancer cells after surgery. After surgery, if any cancer cells remain in the portion or area, we may use adjuvant chemotherapy to eliminate these remaining cancer cells. For advanced breast cancer, chemotherapy can help to control the disease and relieve the symptoms. Anthracyclines, one type of chemotherapy which is used. The drug is doxorubicin. What is the mode of action of doxorubicin? These drugs damage the DNA of cancer cells. If DNA of cancer cells is damaged, so it prevents them from dividing and growing and making a tumor. So that's how the doxorubicin works, by damaging the DNA of cancer cells and preventing them from dividing and growing. Then go for alkylating agent cyclophosphamide. Which kind of mode of action it is done? Cyclophosphamide. Cyclophosphamide add an alkaline group of to the DNA, and which leads to the death of cancer cells. Cyclophosphamide. Then antimetabolites. Antimetabolites, the drug name is methotrexate. How it's work? It's mimic the building blocks of DNA and RNA. It's mimic the building blocks of DNA and RNA and interfering with the cell's replication process. And last one is taxanes or paclitaxels. How it works? Paclitaxels. It also is the paclitaxels work by interfering with the microtubules. Paclitaxels mainly interfere with the microtubules. What is microtubules? Microtubules is essential structure which is needed for cell division. Microtubules are essential structure which is needed for cell division. If microtubules are not work properly, then cell division will not occur. That's how the taxanes work, by interfering with the microtubules. So these are all chemotherapeutic drugs, and we may give chemotherapeutic drugs by intravenously, direct into a vein, orally as a pill or capsule form, or injection. directly into a muscle or under the skin. Previously, we discussed that one hallmark feature of chemotherapy, it's not only affect the cancer cells, it also affect our healthy dividing tissue. So it has much more side effect. What kind of side effect we may see during chemotherapy administration? Nausea, vomiting, hair loss, fatigue, and increased risk for infections and mouth sores also. After completing the chemotherapy, what will be our nursing consideration? After completing chemotherapy, encourage the patients or relatives for follow-up examination and regular checkup, and encourage them for blood test and also imaging study. Additional treatment and lifestyle changes support your condition, support your disease progression. Then we'll be focusing on the radiation therapy. Most patients receive a radiation therapy after mastectomy. For what? For eliminate the remaining cancer cells. And it's use a high energy ray to kill the cancer cells. Mode of action is radiation therapy uses high energy ray to kill the cancer cells. Some patients have radiation therapy before surgery to destroy the cancer cells or shrink the tumor as like neoadjuvant chemotherapeutic drugs, to shrink the tumor and to destroy the cancer cell. It's allow easily removal of the tumor. And some patients have radiation therapy after the surgery. So this is the some information about radiation therapy. Radiation therapy patient may got after mastectomy and patient may receive before surgery. Two types of radiation. One is external radiation, another one is internal radiation. What type of radiation is external radiation? If the radiation comes from the outside of the body, this is called external radiation, and which is called internal radiation. Thin plastic tubes that holds a radioactive substance are put directly in the breast. This is the process of internal radiation. Then we will be focusing on hormone therapy. We use tamoxifen and estradiol for hormone therapy. Tamoxifen has much more side effects, which are there: hot flashes, vaginal discharge, irregular menstrual period, and headaches are the side effects of tamoxifen hormone therapy. Then we will focusing on the biological therapy. We may use Herceptin in biological therapy. What is Herceptin? It is a monoclonal antibody. This is much more important short question. Which kind of which kind of therapy, which kind of antibody we used in biological therapy? This is Herceptin, and this is a monoclonal antibody. And how it works? It is used for those women whose breast tumor has too much HER2 protein present. Which kind of protein present? HER2 protein. This is one important objective question. Which kind of protein is present in breast cancer women? HER2 protein. And Herceptin, how to act this type of patient? Is block the HER2 protein. And if it block the HER2 protein, it can stop the growth of cancer cells. This is the mode of action of Herceptin. Herceptin is used in biological therapy, it is a monoclonal antibody. This much information is very much important for objective question. Then what is the side effect of Herceptin? Pain, weakness, nausea, vomiting, diarrhea, headaches, and also heart failure and breathing problem. So these are all about the breast cancer. Each step, early screening, early diagnosis, breast self-examination, based on the diagnostic procedure, effective treatment planning, chemotherapy, surgical therapy, radiation therapy, biological therapy, hormonal therapy, all the treatment planning are very much important for breast cancer. Accurate diagnosis and accurate treatment planning. So early detection through the regular screening and thorough assessment can save a life, can allow the better life prognosis. So thank you for watching and stay informed and protective and proactive about the health. Thank you once again.